Medicare ACOs, Accountable Care Organizations. What are they, and why are we being told that all Medicare beneficiaries are going to be in one by 2030? Because that's the government's goal. So an ACO does not take business out of the independent insurance agent's pocket. It is a behind-the-scenes coordination between doctors and specialists and all the care. And that's good. That's good for everybody, because right now you see a cardiologist who never talks and has no idea who your rheumatologist is, who has no idea who your whatever is, unless you tell them the drugs. They don't have any idea to see what's being prescribed. They don't see each other's treatment notes. There's no coordination. So accountable care organizations are groups of doctors and specialists and providers that will work together. I want to say quote unquote seamlessly. I don't know. But you know what I'm saying? Like open borders so they can talk to each other. So you get in there and they're talking to each other, which is, I mean, that seems like very simple. Like, wow, how is that innovative for right now? So it is innovative. The government is saying everybody's going to do this. You can either be in Medicare Advantage, which already has its care coordination built in. But if you're staying in government Medicare, people call it original Medicare. You'll notice I don't. I call it government Medicare because I find that clients understand that better. Private Medicare Advantage, government Medicare. If you're in original government Medicare, then you're going to be in an ACO by 2030. So the upside for the doctors being in the ACO is they can get more money, right? So they will be paid not just to see you, which is they're paid right now. They're just paid. It's fee for service. You come in, they get paid. You come in, they get paid. You come in. Maybe your care is terrible, maybe it's unnecessary. They just get paid. They just next. The government doesn't like that. And so they said, we need the doctors to have more skin in the game, to want to have this care improve these patients, to be invested. And I say everybody's going to be involved in that. That's something everybody can support. So this coordination, and the doctors will get paid, and you're going to say, oh, I didn't even know it was in an ACO. Well, you probably wouldn't know. You can look it up. It's public, but it's not going to feel different to you. It's going to seem like it works the way you thought it worked anyway, which it didn't. So it should be smoother. There should be more interest in the outcome. I want you to get better. I'm not just pushing prescriptions. So that's good. That will save Medicare money, and they're going to give some of that savings to these doctors. So if you're going to choose a new doctor, let's say you're moving, you have to choose a new doctor, and they're all in ACOs. Well, I want to choose the best ACO. I want to choose the biggest one with the most specialists and the highest grades. So let's talk about how they're graded. They are graded on patient surveys, satisfaction surveys. They are graded on hospital readmission. That keeps rearing its head. They're graded on after you have a surgery. Did somebody call you? So I remember when I had a surgery a couple of years ago, the doctor called me, and I thought, that is so nice. Like, that was really nice. He called me himself, called me at home at night to see how I was doing. And I thought that was just a nice little extra chef's kiss touch. Like, that's a really good doctor. No, he's getting paid more money to do that. So that was good, because in the past and in the current, most of the time you have your surgery, boom, you're done. Hands off, next client. So were you readmitted? Did you have complications? Let's talk about preventative care. We all know that Medicare, original government Medicare, has generous preventative care. But a lot of people don't do it. They don't want to do it. They don't know about it. Nobody cares. It's not a moneymaker. Well, they made it a moneymaker because they will pay you more if your client gets the preventative flu shot, gets their COVID shot, gets their mammogram, gets their prostate exam. So the doctors are more invested in an accountable care organization, ACO, in getting you healthy. So it's kind of similar, to Medicare Advantage, which doctors are also comped for getting all the preventative things done, and is also kind of pushing you to keep you healthy. In this case, to save the insurance company money. On the ACO, it's to save the government money, and they're giving some of that to the doctors. So there is a downside for doctors in an ACO, and there's different ACO models and different amounts of risk the doctors can take on. So the doctors can take on upside risk, which so the government's going to set a benchmark, like this is how much money we expect you to spend. And if you spend less, you can share in the savings, which is just upside. And then there's a two-sided risk where they can say, if you save money, you get money, but if you spend more than the benchmark, then you got to pay the government back. Okay, so that's where it gets tricky, and it gets a little bit more of the sniff test that we feel with the Medicare Advantage, the managed care side, because we don't want to feel like the doctors, are doing what's in their financial best interest. But you know what I'm saying. I can't say everything I want to say, but you know what I'm saying. So they can be in different types of ACO contracts. And that is public. You can find that information. Go to medicare.gov ACO. They publish that information annually. So just for your own benefit, we're all getting older. We're going to pick our own doctors as we go into Medicare. Who do we want? What type of insurance do we want? Well, if I want a Medicare supplement, if I'm still able to afford a Medicare supplement in 5 years, and I'm going to be in an ACO because that's the government's goal by 2030 to get everybody in an ACO, I want to know which ACO to pick. I want to know which one has the highest score. That's the one I want to pick. So that's just another quiver, a feather in your quiver. I'm so bad at all these metaphors. It's another tool in your toolbox that you're talking about. You're not talking about the stuff during AEP, right? This is stuff you talk about post AEP, but AEP goes by in a flash, and this video will live forever. If you learned something today, please consider following our channel. Hit subscribe below.